Okay, let's talk for a minute about hormone imbalance. And if you are a woman in your mid 30s to mid 40s in that arena, things might be starting to change as far as going through perimenopause. Now, this is early days, but there might be an imbalance in the estrogen, progesterone, testosterone ratios. And so when I assess this with people, I ask them how their periods are, how their PMS, if there's any PMS symptoms, what that looks like, and then I do some testing. So typically, I'm going to do testing in the bloodstream to look at, all right, follicle stimulating hormone, making sure that LH and FSH is good. So that tells us what's happening in the brain, the pituitary, that's looking at the ovaries and assessing what the hormone level is in the ovaries. You can test estrogen and progesterone and testosterone in the bloodstream. Um, it's not the best test because it's just a microsecond. It's just that moment. And the hormones, of course, are changing all the time during the period, during the menstrual cycle, during that whole month, right? And so what ends up happening is that it's easy to get erroneous numbers or to assume that that's what's happening for the whole time. So if you're gonna do testing in the bloodstream, make sure that you do it the week before your period. So that would be usually about day 19 in most women. If you have a 28-day cycle, which means the first day of bleeding is day 1, and then the first day of the next cycle would be 29 days. So a 28-day cycle, you would want to do the testing on day 19, 20, somewhere right in there. And then, because that's going to be the highest for progesterone and for estrogen. So we're really seeing the progesterone level at that time and what the ratios of the estrogen. So typically what I do is test for estradiol, estrone, progesterone, and testosterone day 19, along with FSH and LH. All right. So assessing that is important. There's also something called the Dutch test, which is a dried urine test, which looks at the hormone breakdown. It's a different kind of a test. It's more involved because we're seeing the breakdown of the hormones, and it gives us a sense of overall, not just that second, but overall, what is the hormone balance. Also, it tests for those hormones plus melatonin, DHEA, cortisol, which is really important, right? So all of these hormones work together, and it's important to assess them all at once. And that's what we do with naturopathic medicine. Just a quick little glimpse into what kinds of testing would be the beginning for someone between the age of 35 and 45 thinking that hormones are starting to go out of balance. There's also a lot of other things that I would want to assess for: neurotransmitters, gut dysbiosis, those kinds of things as well. But this is a way to start. Thanks.